I am so honored to be here to introduce my dear friend, Dr. Sharon Malone, who has written a book of great importance, Grown Woman Talk. This is a book that every so often when a book comes along that you feel like everybody has to have on their shelf. And this is one of those books that you're going to want to buy, that you're going to want to gift, that you're going to want to maybe not even keep on your shelf because it is full of so much information that I think you're going to want it close to you so you can refer to it in moments where you have questions. Sharon Malone is a longtime gynecologist and a first-time author. And this is your first bookfest, yes?
It is my first bookfest, and it will probably be my last because I'm 65 years old. I think I got one book in me, and that's it. So.
Well, you know, despite our age, we all have to write our futures in pencil. And given that I've had a chance to plow through this book, I hope this is not your last book, because I think you have a lot of wisdom to share with us. I want to begin with why you decided to write the book and why you decided to put it together in this way, because when you get this book, you'll realize just how it's actually fun reading it. It feels like she's speaking to you. It's almost like I wonder if you actually sat down at a computer or if you talked into a device, because it feels like you're actually talking to the reader.
Well, thank you for that, Michele. And the reason why I wrote this book is that when you are the only doctor in your family and you're the only doctor in your friend group, I spend a lot of time navigating for my friends and family various and sundry health issues. Very few of them actually have to do with gynecology. And I realized that there is a fundamental sort of misunderstanding of how the medical system works. It is confusing, it is inefficient, and a lot of things have changed in medicine, but no one's bothered to inform you. So in the beginning, we sort of set up the basics. You know, how do you pick a doctor? How do you assemble your team? And sort of various practical, aspects of how to navigate this complex system. And I hate to tell you, but all roads are not leading in the direction of making it less complicated for you. And so I wanted to write a book that really gave you the power to be able to make good medical decisions for yourself. And some of it is tough stuff, but it doesn't have to be tough. And I'm writing it not as a doctor who's here to finger wag and tell you things. I'm writing it as a sister, as a friend, as a daughter. And this is information that I want my family to have. And this is the type of information that I shared with you.
So Sharon is one of my closest friends. So this is like the two of us on stage when we're normally like sitting at a coffee table just talking. And can I share with them what the title of the book almost was?
Of course.
So at one point you were thinking about calling this a love letter to my sisters, and that says something about the intent behind the book.
Exactly. And I'm the youngest of 5 girls. I'm the youngest of 8 children, but there are 5 girls in a row. And a lot of the stories that I tell in the book, some are patient stories, a lot are family stories. And as I've watched my family members age and some of the situations that I have had to deal with, I want everyone to understand that this is not me talking from here to you. No, this is as a peer. These are issues and situations that I've dealt with in my own family, many of which I've shared with their permission, of course. But it's that kind of conversation that we haven't had. We haven't had within families, and we haven't had that conversation intergenerationally. And I want us to start that conversation. So we start there. I share stories because I think everything is a little bit easier when you tell a story. It's easier to understand what we're trying to do, because I think some of you will recognize yourselves in some of these stories.
Can we ask the audience a question? How many of you had a conversation about menopause with your mama? Not a lot of hands went up.
Not a lot.
Yeah, I mean, so there's no guide. Now you have a guide. You mentioned something I just want to cycle back to. I don't want to let it go. You said how to assemble your team.
Yes.
And many of us think if I have a doctor, that's enough. But you're telling us that that's not enough. You actually need a team.
You do need a team. And at various points in your life, you may need 1, you may need 2. When you're young, generally, your gynecologist is your team. And then as you get older, you need to add different doctors. Everyone should have a primary care doctor at least by the time they're 40. and then on. But let me say this. How you pick doctors, we sort of do things, as we say, ass backwards. We sort of decide, okay, I like this doctor, someone tells me this one. And when you need another level of care, you go, well, who is the best cardiologist? Who is the best endocrinologist? Okay, well, that's great. But do they all know each other and do they talk to each other? And there are some logistical concerns about you think you have the best, but it's not effective for you because I hate to be the bearer of bad news, but your doctors don't talk to one another. And all of the stuff that I'm here to tell you that you think, well, didn't my doctor send my records? No, they didn't. If you don't pick doctors that are within the same system, and these are just, again, these are practical tips. It has nothing to do with, the competency of any of the people involved. It matters whether or not you choose doctors that are within your insurance plan. Otherwise, you leave money on the table. So one of my favorite sayings is, don't let the perfect get in the way of the good. And I also say, for most things, most doctors see them commonly. And occasionally, though, you'll be something that you only want to be at a cocktail party. Interesting. And when you get something that is interesting and difficult, then that is the time to go outside your network and say, now I'm looking for the best. But garden variety things, choose people that work together. And these are things I think people don't really think about, and they are confused and also oftentimes sort of wasting time while doctors are trying to communicate one with the other.
So let's say the word menopause, because that's a word that generally people whisper. Menopause. But menopause is having a moment right now, and Dr. Malone has something to do with that. You were on a podcast with Michelle Obama in her first podcast, and you had a conversation. You took this issue out of the shadows and into the world in a way that really helped accelerate the way that we talk about menopause now. And menopause is having a moment. We're actually talking, there are magazine articles about it, there are podcasts about it, we're actually talking about it. Men are talking about it, which is, a big step forward. But why has it for so long been under-researched, underexplored, underfunded? All the wrong prefixes ahead of the words that, are important when you're thinking about medical health.
Menopause is one of those situations that, unfortunately, we associate with aging. And aging and conversations about aging in this country are not had unless we're talking about anti-aging. There's a lot of that. Get this cream, erase this, take this. But the real conversation about how to age healthfully is something that we haven't had because of the negative, the stigma. I don't want to, I'm suffering in silence. We don't talk amongst ourselves. Our doctors don't talk to us. Because here's the thing, you would not have a situation where you entered a pregnancy or even a child who's entering puberty with as little information as women have entering menopause. And trust me, menopause is going to last for the rest of your life. So it's time, and I think with the conversation that I had with Michelle was enlightening in that sense that people say, oh my God, Michelle Obama admitted she has hot flashes. Well, then maybe we can talk about it too. And I want the conversation to be broader because it is about your health as you age. Menopause just signals that time of life where we need to start paying particular attention to it. But let me say this, I call my book Grown Woman Talk for a reason. Menopause is a part of the book, but as I was thinking about what the subtitle would be, and does anyone remember that book, What to Expect When You're Expecting?
Oh, yes.
Well, this book is What to Expect When You Expect to Live Past 40. It's all of those things. Someone even came up with a cleverer one. They said, what to expect when you're not expecting. That's in there. So it's a lot of stuff that you should start paying attention to in midlife. And to be quite honest with you, I think it's a book that you should give your daughters. Because if menopause is one of those conditions where if you have ovaries, you will be menopausal. It is not optional. So the more you know in advance, before, during, and after, the better advocate you can be for your own health.
And I see some men in the audience, and I'm delighted to see you here. And it is the kind of gift that you can give the people that you love also. You might want to think about how to do it. I'm thinking about the moment my dad gave my mom an electric frying pan, and she was like, mm-hmm. But it is, and when you mentioned what to expect when you're expecting, I bet more than 50% of the women in this room had that book. I am Sharon's hype chick because she's my best friend. I think this is that kind of book, that we're all going to have this book also. So let's talk about menopause myths.
Sure.
Because you bust some of the myths in here, beginning with the idea that hormone replacement therapy is something that you have to be careful of because of cancer risks, because of estrogen levels. You've done a lot of work to help us understand what the real dangers, but also what the real benefits are.
Right. I think that the dangers of hormones have really been overhyped, but you didn't make that up. You know, I think that we in the medical community have to take ownership of that. And there was a study called the Women's Health Initiative that came out 21 years ago, and that's where that notion of hormone therapy, it's dangerous, it doesn't help your heart, it increases your risk of breast cancer, and that was really the nail in the coffin of hormone therapy. But let me tell you a little bit about the history of it. Hormone therapy for the treatment of menopausal symptoms has been around since 1942. So there's not much that we don't know about the use of hormones. It's not new. It was used for treatment of symptomatic menopause. Well, that's how it was used for the first 50 years that we used it. And as we sort of watched and said, wow, women who took hormones, there was an observational study where they just watched how did you fare through the menopausal transition. And they found that the women who took hormones had half the risk of heart disease. And for those of you who don't know, heart disease was then and is now still the #1 killer of women in this country. And we're afraid of breast cancer, and we pay no attention really to heart disease, except in February when it's Heart Month. And imagine the impact of a medication if I told you that it would have your risk of heart disease. Well, that would be fantastic. That was where the study came from, where the Women's Health Initiative really changed the conversation about it, because we were very proactive about prescribing hormones before 2002. Well, when they said it doesn't decrease your risk of heart disease and it increases your breast cancer risk, well, imagine what happened to hormone use. It plummeted. And not only did it plummet, it put in women's heads the notion that hormone therapy is dangerous. And it put in the heads of a generation of doctors. So if your doctor is between the ages of about 35 and 55, chances are they think it's dangerous too. And that's unfortunate, because it not only disadvantaged a generation of women, but it also disadvantaged research into menopause, because there are many more questions and many more benefits that I think that are there that we need the data to really support. So I'll say this about hormones: there are very few contraindications. If you are suffering, treat your symptoms. There's no benefit in saying, oh, I'll just suffer through it. And that's the language that women have about everything. We suffer from cramps. We suffer from migraines. We suffer through bad relationships. We suffer through as if somehow you're going to get a gold medal at the end. You don't. So if you are a person, don't let the fear of whatever it is get in the way of you getting accurate information and alleviate your own suffering. That's the message I want all women to get.
Amen. Can we get an amen to that? So just quickly, a few other menopausal myths. That menopause is a condition of old age.
Oh, no. All right, so let me explain a little bit here, and it will make a little bit more sense to you. Menopause is really defined as when you've had your last period. It's confirmed after you've had no period for a year. Average age is about 51. That's when we think of menopause. But the reality is the menopausal transition can start anywhere from 4 to 10 years prior to your last menstrual period. So that means for the average woman, symptoms that we associate with menopause, hot flashes, mood swings, sleeplessness, brain fog, these things happen in your 40s. And for some women who have early menopause, maybe in your 30s. So we're not thinking that these things may be associated with menopause, and many of you may have even gone to your doctors and you're complaining of these things, and your doctor says, well, it must be your thyroid, it must be any number of things, but they're not thinking about menopause either. And I want you to know that this is a process, that transition from your peak reproductive years to your last menstrual period is sometimes a decade in the making. So don't let someone really gaslight you. If you're having symptoms, you're having symptoms. This is a clinical diagnosis, that transition or perimenopause. If you're having symptoms, you're perimenopausal. And I will also say this, if you're between the ages of 40 and 50 and you're not having symptoms, you're still perimenopausal. So that is the time to really start thinking about it and figuring out what your course is going to be. Everyone's menopausal journey is different. However, a lot of it rhymes.
Okay, I'm intrigued. It rhymes.
It rhymes. And by that I say, even though we said, this is the guidance we give women. Everyone should have individualized care with a caring and competent doctor who understands menopause. Wouldn't that be fantastic? Even though there are 34 symptoms of menopause, you may have 1, 2, 6, all 34. The reality is that the constellation of symptoms is known. So, but which of those you're going to have, we're going to see. But it's not as if it's something we don't know how to treat. And that's something I want you to understand. Yours may be different from your sisters or your cousins or your neighbors. And don't take advice. I do say this all the time. There are people that will have very few symptoms, and they will say things like, well, I didn't go through menopause. Or you ask your mother, and of course she did, but she forgot.
Or it wasn't that bad.
It wasn't that bad. It's like childbirth. Can you really remember the horror of it? Not really. You know, nature has a little erase button for stuff like that. But you know how you feel. And don't take someone else's advice because they had a particular journey that it will be typical as yours. You treat you. And that is really what I want to give you really a good sense of in the book, is to give you an idea of what it is, what it means, how long it lasts. And let me just say, there is no such thing as being post-menopausal. I don't like that word, but you'll see it. And that means it implies you're over it. But once you've had your last period and your estrogen levels plummet and they stay down, the long-term health consequences of that will continue forever, not just when you're going through the period where you may or may not be symptomatic.
So you talk in this book about reproductive health beyond menopause, and there's another word that you bring out into the open in this book, talk about that women suffer through often in silence, and that's fibroids.
Yes, fibroids.
You know, many women have them. Many women have them but never talk about them. Many women have them and don't even talk to their friends. And they try to talk to their doctors, and doctors don't always have the kind of conversation that should be had to help people get through this. But there's one thing that you talk about is untangling the cost of fibroids.
Right.
Help us understand what you mean by the cost of fibroids, and what is it that you're untangling? All
right, give you a little level setting. 70% of women at some point in their lives will have fibroids. 70%. Now, they may be small, you may not even know you have fibroids, but they're very, very, very common.
Can we just stop for a minute just to give them a picture? That means that everybody on this side of the room and several people on that side of the room.
Right.
I mean, just to give you a sense of that, just so you understand. Proceed.
Right. And if you are Black, 80% of women will have fibroids. And let me tell you what the difference is, you know, and just having fibroids, okay, you have them. If they are asymptomatic and they're not bothering you and you don't mind them, we don't have to do anything about fibroids. But when you suffer, and we use that word again, from fibroids, pain, painful intercourse, bleeding, heavy, heavy bleeding, these are the kinds of things that affect your quality of life. And again, why would you let them just sit there if they are bothering you? Only about 25% of fibroids actually come to medical attention, either surgery or otherwise. We have many, many, many medical treatments that we can use for fibroids. More often than not, women don't avail themselves and doctors don't really discuss it. And let me say, and there is a huge racial disparity in that. Black women tend to have fibroids at earlier ages. They are larger and they are more likely to be symptomatic. Hence, more black women are likely to have hysterectomies. And the cost that we're talking about here is missed days at work. You know, if you are afraid to leave your house because you are bleeding so heavily you can't be more than 5 feet from a bathroom, that's lost productivity. You can't plan your vacations, or you've got to cancel something because your life revolves around your period. That requires attention. But there's an even more basic cost of this. If you are bleeding so heavily that you are going through tampons, pads at twice the rate of someone else who has a much lighter period, that's an economic cost to you. And let me just say, I haven't had to buy in a while, but I have daughters, and pads and tampons are not cheap. And so think about that in terms of, you know, not only the cost in your quality of life, the lost productivity, and just the cost of sanitary products. I mean, that's a problem.
Can we just have a word about the cost of sanitary products? Why do we have to buy them when we go to work? I mean, I'm just putting that out there, you know? I mean, you don't bring your own TP to work. Wouldn't it make sense that they would just be made available to you? I'm just putting that out there.
You know what, and I'll tell you, there's a woman that I work with a lot. We've done a couple of op-eds together, Jen Weiss-Wolf, and she has done a lot on menstrual equity. I mean, things that I never thought of. Yes, they should be available in schools, in public schools. What do young girls do who cannot afford, you know, a $15 box of tampons? They should be available in schools. They are not available in many states in prisons. Now think about that. Women have to barter or buy sanitary products, and if you're using more than what they consider an ordinary amount, then you have to use your commissary money to buy sanitary products. And Jen Weiss-Wolf does a beautiful job of explaining the policy of periods, not just the actual medical aspect of periods.
When you read this book, and notice I said not if you read this book, I said when you read this book, you will see yourselves in this book, because there's Yvonne, and there's Jacqueline, and there's Belinda, and there's women that Sharon knows, has doctored, has talked to, and she brings their stories into the book. Why was that important to have real women in the pages of the book?
Because I think storytelling is important. I mean, I think that you can see yourself in some of these stories, or you might see a friend or a family member in these stories. And I think it illustrates the point. I could talk about these things ad nauseum as a textbook, and you'd be bored to tears, and you're like, okay, thank you for that. But when you have a story, you will remember the story. And there's a small takeaway at the end, and I'm repetitive on a lot of things, because I'm going to say, in case you missed it in chapter 2, let me say it again why it's important. Because some of the things that we need to do on the prevention front, they're important in various aspects of our lives, whether it's cancer prevention, whether it's heart disease, whether it's Alzheimer's. The same 5 or 6 things that you need to do to prevent those, they're the same 5 or 6 things. So yes, I'm going to say it again, and I'm going to give you a different reason why it's important. And by the time you get to the end of the book, you're like, okay, I got it.
And by the time you get to the end of the book, you also have a series of fantastic playlists, because Sharon's personality is in the pages of this book. It's written in her voice, like I recognize her voice as I'm reading it. And Sharon, when you go to her house, there's always fantastic music playing. We share music all the time. And in every chapter, there's a suggested playlist. There's a song that goes with every part of this. So, and some of them are obvious. It's getting hot in here.
Yes. That's the menopause chapter.
Yeah.
It's not getting hot in here.
So some of them are obvious and some of them aren't. But it's really a beautiful, felicitous part of the book. You also talk about intimacy and sexual health in the pages of the book, and the importance of having constant intimacy, including solo sex.
Of course, yes.
Which is a term that is interesting. And actually a way to talk about it in a way that, again, words matter.
Yes.
The narrative matters. So.
And again, it's just destigmatizing, the notion of sex. I know what happens in doctors' offices. I've spent a little time in there. And particularly younger, if your doctor is younger than you, they are probably not going to ever bring up the idea about sex in anything. I think that should be discussed if you've had cancer treatment, if you've had breast cancer, colon cancer, you've had chemotherapy. These are things that will affect your sexual health and your sexual life. And if your doctor doesn't bring it up, I think you should ask that question, because there is no reason to be embarrassed. And I assure you that women of a certain age do have sex. Maybe not often, but we do. But this is something I want. There's a reality that as we age, we may, for various and sundry reasons, be unpartnered. Maybe you're divorced, maybe you're widowed, maybe you're just not interested in a relationship at that particular time. Then that doesn't mean that that's the end of your sexual life. Then that's where solo sex comes in. And one thing, all right, here's another Dr. Sharon pro tip. If you don't own a good vibrator, go buy one. You don't need, and again, there are many reasons why intimacy, and let's be very clear about that. When I say intimacy, I don't really mean just sex either. It's affection, it's touching, it is having a relationship with someone that you can be intimate with. And that has nothing to do with whether or not you have intercourse. So that's a very important part of women's lives that I want you to all not neglect. And sometimes you need to be intimate with yourself, because, nobody knows you better than you. So use that information, and you know what? If it makes you feel good, whatever that is, by all means do it.
Give yourself permission. You also talk about a different kind of intimacy and the importance of friendships. That friendships are a prescription for a healthy and a happy, and in many cases, a longer life.
Absolutely. Being the youngest of 5 daughters, I've grown up in the company of women. I love the company of women. And Michele and I are part of a group of, what we call ourselves, a posse,
the
a
sister
kitchen table. We
live 5 blocks from each other.
We do. So we spend a lot of time together. But those are some of the most rewarding relationships that I've had. And let me just say that when you assemble your friend group, just like you assemble your doctor group, I say, it's not, at this age, you don't need to have a best friend. You can have several friends. It's assembling your community, because these are women that you are going to share your health journeys, your relationship journeys, and just basic support. We have fun. We have way more fun than we talk about issues. But I have someone that you know and trust when I do need to discuss those issues. And that's why I said relationships, when I talk about relationships, and I'm talking about your entire community, not just whoever your partner happens to be at that time or none. Women have more fulfilling lives when we have other women in them.
And when you put that planner together that I know many of us have, and that to-do list, friendship is an important part of that. Block off time. Make the investment. It's a garden that you have to till, that you have to water, that you have to nourish, that you have to fertilize.
Right, right. And sometimes you have to pull a few weeds too now in that garden of friendship. People that don't serve you, gotta go. This is where, and this is a message too that I want women to get, is that we spend a lot of time, and menopause it's all over the place now. And for that I say, yay, yay, yay. But I also don't want to focus on just the negative aspects of menopause. You know, I am at a point in my life now where I don't think I've ever been happier. And I think that we've got to get away from this notion that, oh, and then I'm going to be menopausal, and then I'm going to be old, and then I'm going to break a hip. No, no, no. There are a lot of things that we can do to stay vibrant at this age, and the one good thing is that changing the face of menopause is now you get to look at someone and say, this is what 40 looks like. This is what 60 looks like. Oprah just turned 70. I mean, Michelle Obama just turned 60. So it is not a fearful place to be, and I think you really can get a renewed burst of energy. Michele just finished a book and has her beautiful book out now, available in the bookstore here, by the way.
Talk tomorrow.
But there are so many more things we can do, because I think it's a point of life, a point in our lives, where for the first time ever, we get to just think about ourselves. Mm-hmm. You've either raised your children, your relationship is or is not whatever it's going to be, and you are relieved of some of the things, your other people's burdens that you've been taking on for most of our lives, because that's what we as women do. And now it's your time. That's a great time of life to be in. So I don't want anyone to leave here with the message of saying that it's a negative phase of your life. I think it's a wonderful phase of life. I probably like this certainly more than my teenage years, for sure.
I actually like it. This is the happiest period of my life, and in part because I give myself permission to do things. And one of the things I give myself permission to do is to have friendships.
Right.
And to cultivate friendships. And part of the importance of that is, you know, I'm talking about I'm her hype chick. She's mine too, as you just heard. But hyping each other up, it costs you nothing. I mean, I walk through the streets, you look so good today. Oh, look at the shoe. I mean, I am always like, and I do feel like it's like spreading seeds, like telling other women how wonderful they are. It's a secret superpower that we all have within us, and we should probably use it more.
Absolutely.
You also, in this book, talk about aging. And there's one thing that I wanted to share with people, because you talk about Alzheimer's, and we're going to take questions in just a minute. But you introduced a term that was new to me, cognitive reserve.
Yes.
What you do now that you might set yourself up better in the future. Help us understand that.
Okay. Tell you a couple of facts about Alzheimer's. And again, and until I really got deeply immersed in this world, I did not know. 2 out of every 3 people in this country who have Alzheimer's are women. And it's not because we live longer. For black women are twice as likely to get Alzheimer's as white women are. If you are a woman, it is almost 100%. Even if you are lucky enough not to be one of those Alzheimer's victims, you're either caring for a parent, a sibling, someone in your family who has. So there is no escaping Alzheimer's when it comes to our lives at a certain point in our lives, and that's where we are. Cognitive reserve. Now, there is a lot of stuff, and I'm going to do another plug for a friend of mine, Dr. Lisa Mosconi, has a book out now called The Menopause Brain, and she really explains what the correlation is between menopause and lack of estrogen and the further development of Alzheimer's. Now, here's another little tidbit. Women develop Alzheimer's a little bit later in life, but here's the thing about women. We don't actually develop it later. It's because we're able to hide it longer.
So it's symptomatic. It's symptomatic later.
It's symptomatic. Well, it is if you talk to people who are dealing with Alzheimer's patients, they'll usually tell you, in retrospect, there was something, this has been going on for a while. And this is the bombshell about Lisa Mosconi's book, is that she said, Alzheimer's is a disease of midlife, which produces symptoms when you're older. So it's often years to decades in the making, and that's why I want you to take heed, know this, when you're in your 30s, 40s, and know what you're at risk for. And the cognitive reserve piece of it just means that it's simple. If you have, the more you have in your head, if you lost 50% of it, you still have 50%. You have more than if you only had, this much in your head. The amount of time that will take for you to get to the point where you are symptomatic. So that's why I said be mentally active, not just physically active. That's huge. But, I said learn a language, do something. And even with the physical piece of it, if any of you have ever dealt with anyone with a stroke, that's why we say exercise is important, core is important. You can relearn how to do physical activities. But the more muscle groups you have to draw from, when and if you have to relearn those things, you've got more pathways to get to it. The same is true of your brain. If part of your brain is gone, if you have exercised and you've got other routes, it's like GPS. If you only know one route to get there, if that road goes out, then you're stuck. Sorry, got no cell service, don't know how to get there. But if you have tried multiple routes to get to that, if and when this becomes a problem with you, and there's a certain amount of cognitive decline that just happens with aging, and that's normal, Alzheimer's is different, then the more paths you have, the better function you will have later in life. So that's the concept of cognitive reserve. Know more, do more, be more engaged, because this we do know that people who have less social engagement are also at higher risk for Alzheimer's, right. And probably just because they don't have that cognitive reserve.
And that effect of loneliness on people, that goes
Right.
back to friendship. Let's take a few questions. We've got 2 microphones if people want to go to the microphone. Introduce yourself and tell us your question, please.
My name is Raquel, and I have a question about the fibroids in African American women. First, why is it so that African Americans have such a health disparity with that, and what could we do possibly to prevent it?
Why we have a disparity in fibroids is a question that is left to be answered, because there's really not a lot of research about it. But a lot of it does have to do with things. So you say, what can you do to prevent it? Well, I'll give you some theories about why. Don't quote me on this. But there is a lot to say about our diets. We have hormones in everything, in our meat, and fish. Everybody's there's something. So there may be some component of that to it. We do know that fibroids are associated with women who are overweight. There is also a hereditary component to it. So what the genetic basis is for fibroids, we don't know. But that's one of those questions that we need to get the answer to, because just about name any condition for African American women, and your risk will be higher. And a lot of it may have to do not just with your genetics, but with the lived experience of being a Black woman in America. So it's not your genes, it's your environment. And these are questions we need to get answers to.
We had a question here, and then we'll go to the back.
I just wanted to say you two Washingtonians are amazing, and my congratulations to you. You should go on the road together. And I may be wrong, but I think I'm probably the only former patient of yours in this audience.
Oh, wait.
But, hello, everybody.
They're everywhere.
When I was a young mother and I called the practice and they said, would you like the new doctor? I said, sure. And in walks this young, amazing, vibrant woman who had little kids of her own. And I just had this amazing 20 plus years with you, and you were always so wise. I have to say that. She was totally wise all the time, ahead of things. And just as you can see from what her talk today, just warm and engaging and always there for you. And I had a situation once where she really was there for me, and I just want to let you know she was an amazing doctor. And also, I think that the group here might want to know, since I follow both of you on social media, they both love gumbo.
That's true, because I'm from Mobile, so all right, New Orleans.
It's
just saying.
Home of the original Mardi Gras.
Yes.
So,
Gotta say it. Gotta say it.
Controversial. Okay, we have to move quickly. So I'm going to do something. I'm going to ask you all to ask your questions, and then she's going to give a speed answer, if that's okay. So 1, 2, 3. If you all just ask the question, and then she'll.
Now you're assuming I'm going to remember.
I'll remember. I'll remember.
Right. Okay, you'll remember.
I love your presentation. Thank you so much for talking about this very important subject. Thank you. So my name is Monique de la Cour. I have a personal training and health coaching business focused on women over 50 and fall prevention and osteoporosis in particular. During menopause, a lot of factors come together that make all of us a significantly greater risk for fall prevention. But doctors do not speak about that. The women I see have lost confidence in their bodies. They don't know what to do. They've already experienced the fall. Can you tell us anything about what doctors should be doing to pay attention to this topic so we can lead a joyful and vibrant life?
Okay, so what to pay attention to around osteoporosis. You had a question?
Hi, Sharon. I wanted to be sure that you mentioned your amazing sister, because I think not only do we need to share this news of this book with our kids, but also share your sister and your family story.
Okay, so a word about Vivian,
Okay.
and we should say a word about Vivian and bring her into the space, and the last of our troika of questions.
I wanted to know if you have advice for particularly the young, like 35 to 50-year-old women like me who are caretaking for elderly people or elder parents who are going through things, who did not do their advance directives and won't. Because I think end-of-life questions are something we avoid, and it's not helpful.
Yeah, living through that right now.
Okay, I'm going to
So-
answer that right quick, because that's the last chapter in my book about what are the kinds of things you need to do to get your metaphysical house in order. So there's an entire checklist about things that you need to do, whether you're dealing with aging parents or even things that you need to do for yourself. So yes.
Osteoporosis.
Yes. Osteoporosis is an underappreciated condition that really gets accelerated during menopause. So yes, we all need to pay attention to it. And again, we get to it late. We wait until you get a bone density and go, oh, you have osteoporosis. And then we put you on expensive medications. You start with osteoporosis prevention in your 30s, your 40s, exercise, calcium and vitamin D, even though you need them as you age, they do not reverse osteoporosis. So no, if you wanted to say what's the preventative thing you can do for osteoporosis, hormone replacement therapy or estrogen therapy has an FDA-approved indication for prevention of osteoporosis, underappreciated.
And Vivian Malone, Sharon is civil rights royalty. There's a picture that many of you may have seen with a young student trying to enroll at the University of Alabama, and George Wallace is standing in the door trying to prevent that from happening. That student was?
Vivian Malone, my oldest sister. And I think it's befitting. It's Women's History Month, and I never like to have an opportunity pass by to mention her name. And I lost my sister 18 years ago, and I think prematurely, and I tell her story in my book. Because I think that the underappreciated thing is what stress does to you, chronic stress does to you. And my sister, as brave and strong as she was, I can't imagine what it's like to confront the governor of Alabama and have National Guard have to escort you into your dorm. And she went to bed that night thinking all was well, and she woke up the next morning, the very next morning, to find out that Medgar Evers had been shot and killed in his driveway. So she was under an incredible amount of stress throughout her life. And I think she paid the price for it with her life. And I would encourage you, and the story's in there, and I won't, but thank you, Linda, because Linda sent me something just day before yesterday that I had never seen. Linda sent me a picture of a letter that my sister wrote to her lawyer at the Justice Department asking if she was coming to Washington, D.C., and she said, I wonder if I come to D.C. if I would get a chance to meet the Attorney General. Now, my sister, if she could have she couldn't have imagined that one day that her sister would be married to the Attorney General. So, that's how history goes. It's a circle. So
one last thing I'm
Linda.
going to say is I host a podcast called Your Mama's Kitchen on Audible. It's available on Audible first for 2 weeks and then in broad distribution wherever you find your podcasts. Sharon is an upcoming guest, and we tell Vivian's story in a beautiful way with lots of historic audio in that upcoming episode. Dr. Sharon Malone, you're a queen among us. Thank you so much. Love you and so proud of you. The book is Grown Woman Talk, your guide to getting and staying healthy. Buy it, read it, share it.